Cold and flu symptoms can be pretty similar, and it may be difficult to know which type of infection you have. So here are some tips to help you tell the difference. Cold symptoms are more likely to affect you from the neck up. So think of things like cough, runny nose, and stuffiness. When it comes to the flu, it's gonna affect your whole body. So you're likely gonna have a fever, body aches, and fatigue, feel overall unwell. That's a really easy way to tell the difference between the two. Now, why does it matter if you have a cold versus the flu? There are prescription medications that you can take as soon as flu symptoms appear that can prevent complications and help you feel better faster. So if you learn to recognize those symptoms, you can get treatment. If you get a cold, it's much less likely to develop into more severe complications, whereas a flu can have higher risks for those around you who maybe don't have as strong of an immune system. So knowing that you have a flu can help you take steps to isolate yourself and protect yourself from infecting other people. So now that you know about a cold versus the flu, where does COVID fall into play? So there are two symptoms with COVID that are a little bit different from a cold and the flu. First, you almost always have a sore throat when you have COVID, whereas sometimes you may or may not have one with a cold or a flu. The other thing is that COVID can sometimes affect your ability to taste or smell, and that's usually a hallmark sign that it's COVID. At the end of the day, both COVID-19 and the flu have prescription treatment options that can help protect you and get you feeling better faster. So if you think you have either one, it's best to seek medical care for treatment and take steps to isolate yourself from others so you don't spread the infection.